Hi, my name is Tracy Craig, and I'll be moderating the meeting tonight. This is the Water Board's meeting to discuss environmental issues related to the former Ford Aeronutronics property, and specifically to discuss environmental issues at the Corsica Villa Townhomes. Thank you all for joining us tonight. We have a short presentation. You're welcome to ask questions during the presentation. We also have lots of time at the end of the presentation for questions and answers. John, next slide, please. I'm just going to quickly go over some ground rules. This meeting is being recorded so that we can upload it and people can watch it at a later date if tonight wasn't convenient for them. We'll be answering, as I said, questions throughout the presentation. And you can ask questions one of three ways. You can type them in the chat box, and John Permani is monitoring that. You can physically raise your hand and we'll call on you, or you can virtually raise your little hand and we will call on you as well. We have several different speakers tonight, so there's natural breaks in the presentation. We'll pause and ask people if they have questions. And then again, this is to hear from you. So anytime you want to talk, please feel free to do so. For property-specific questions, we would like to talk with you offline just because we like to respect people's privacy when it comes to that. So if you do have a question that is specific to your property or results in your home, we ask that you either call the 800 number, you can call Jessica Law, you can email us, and we'll get back to you and set up an appointment. And John will type all of that information. We have it at the end of the presentation, but he'll type it all in the chat box who you can call to discuss property-specific information. And next slide, John. Okay. The purpose of the meeting tonight is to discuss the findings of the Human Health Risk Assessment, also to discuss the results of a recent soil vapor extraction pilot test, share next steps, and then, of course, answer your questions, which we're most interested in hearing. There were several handouts that we've been giving out over the life of these projects. They're listed here. If you don't have them, please just type your email in the chat box, and we'll be happy to email those to you tonight. You can also go on Ford's website. John's typing in that website in the chat box and download that information as well. And now I would just like to introduce the folks that we have tonight as panelists. And if our attendees afterwards would like to introduce themselves, we'd love to see your faces and have you introduce yourselves as well if you're comfortable doing that. So first from the Water Board, we have Jessica Law, who's the project manager. And I think everybody knows Jessica quite well at this point in time, but I'm going to have her raise her hand. Okay. And then we also have Amanda Palumbo, who's a toxicologist with the Office of Environmental Health and Hazard Assessment, usually referred to as OEHA. And then we have several folks from Wood. And as a reminder, Wood is the environmental consultant for Ford, and their work is overseen and approved by the Water Board. So we have Mike Barnes, who's the project manager overseeing the entire project. I think you know Mike. We have Daniela, who is the engineer of record for this. And then we also have a new face tonight, Jane Parkin-Coleman. She is a toxicologist, and she'll be giving the talk tonight on the Human Health Risk Assessment findings from Wood. And I think that's all we have. And so the layout of the meeting tonight, we have, I'm going to be giving it over to Jane, and she'll talk about the Human Health Risk Assessment. And then Amanda Palumbo, who is a state employee, will give her interpretation of the risk assessment. And then we'll talk about the soil vapor extraction. We'll talk about the soil vapor extraction pilot study, and then time for questions and answers. Once again, if you want to comment, type it in the chat box, raise your hand, physically raise your hand. And I'm going to pause right now and just see if Kathy or Suzanne or any of our other attendees would like to introduce themselves. And if so, we'll just give you a moment. Hi, Suzanne, please go ahead. Hi.
I'm Suzanne Lang, and I'm here at 3 Corsica Villa.
Okay, pleasure to meet you, and thank you for taking time this evening, really.
Thank you.
Anybody else? Okay, I think not, so I'm going to hand this over to Jane Parkin. And Suzanne, please feel free to ask questions anytime, and I'm so glad to see a face.
And then I just have another, all the names, okay, there, I see it right there. Okay, all the people that you mentioned.
There's a lot of
my
people,
question.
exactly. So we
Okay.
have on the presentation, we have on the agenda, we have all the names,
Yep.
and the presentation will be uploaded to the website. Okay, all right. Jane, please take this away.
Great. Thank you, Tracy, for that introduction. And good evening to the residents and representatives, sorry, of the Corsica Villas. I will be talking about the human health risk assessment for this area. The risk assessment is an important document, and Wood has a large team of scientists that are specifically trained to prepare risk assessments, and that is what we focus on. So as mentioned, my name is Jane Parkin Coleman. I've been conducting risk assessments for about 15 years, and you may have seen my colleagues, Karen or Usha, at other meetings, and they and I are part of the team that has prepared the risk assessments for the Forward Aeroneutronic site. Just to introduce some context, a risk assessment is all about the chance of an event occurring. So this is about chances and doesn't represent certainty. Perception of these risks or chances is about choices and behavior, and those vary by individual. So when we conduct a risk assessment, it is to help people inform their choices. We do make some risk management recommendations in the risk assessment, but risk management is ultimately the water board's role and is part of what they do. Next slide, please, John. Okay. The 4 key components of a standard risk assessment have been presented at the community-wide meeting, but we know that many of you may not have been at that meeting, so we just wanted to introduce these concepts again. Wood has done all of these steps in the risk assessment, and that whole process is what we are reporting on tonight. So the 4 steps are shown here. The first step is data collection and evaluation. This includes deciding which contaminants we are going to look for, and then determining where they are and how much of them are in the environment. So specifically for this site, for the human health risk assessment, we collected samples of indoor air and soil gas. It's important to note that the more data that we have to put into this process, the more confidence we have in the results. The data used in this risk assessment have been collected over about 2 years. So that's what we have for the first step. The second step of exposure assessment is the who, what, when, where, and how much of the risk assessment. So that's where we answered those questions. The process of evaluating exposure is designed on purpose by regulatory agencies to be protective of human health. So for example, one of the assumptions that we make about exposure is that a resident is present in their home for 24 hours a day, 350 days per year, and they are living in that property for 26 years. So then the next step is toxicity assessment, and that specifically refers to the numeric criteria that are used to evaluate how toxic a chemical is. Our toxicity criteria that are related to both cancer and non-cancer effects. Only some chemicals are considered to potentially cause cancer, so only those have cancer toxicity values. All that information put together, the chemical data, the exposure assessment, and the toxicity values, is used to do the risk calculations. And that is where we estimate both hazard, which is the non-cancer component, and the cancer risk for each specific residence. Next slide, please, John. So Jessica also presented this slide on risk management at the community-wide meeting. And so the main message that we wanted to convey with this slide is that we get a lot of numbers out of the risk assessment. And of course, as I said, some of them are related to the chance of cancer or cancer risk, and some are based on non-cancer hazard, which is the other effects not related to cancer. So based on the ranges of those numbers, which are shown here in the left column, we put the results into decision boxes, and that's what's shown in the right column. So when a result is in the red range, agencies like the Water Board recommend that some action needs to occur to reduce those risks. When a result is in the yellow range, we need to determine what to do next. And so that might include something like additional investigation or monitoring. And then when a result is in the green range, it means that the health risk is considered insignificant and no action needs to occur.
Excuse me. So
Oh,
how
sorry.
would you know what range you're in from
Oh,
the report
yeah.
that you guys did? You've been here 3 times and I've tested positively. So how would I know where I fall?
Let's see. Is that Suzanne? Hi, Suzanne.
Yes.
So I don't have the details like immediately at hand. So all of our risk assessments are on the GeoTracker, which I think Jessica is going to touch on a little bit later, like where all the files, you can access all the files for the site.
And I think for this purposes, this is kind of an overview, Suzanne, and specifically to your results. Happy to set up a meeting with you to discuss those specifically.
And who would be the best person?
You know, that depends who you're comfortable with, right? Jessica Law is with the Water Board.
Okay.
You can also meet with Jane.
I probably won't talk to Jessica because she has not helped me at all.
Okay, that's fine. So I would suggest, why don't you talk with Mike Barnes and with Jane, and we can set that up with you tomorrow at a time that's convenient for you. Okay?
Okay.
And we have your contact information, Suzanne, so we'll reach out to you.
Yeah.
And that's Mike?
Yep, that's Mike Barnes.
Okay, thank you.
Of course.
Okay.
Thank you so much.
All right. So the risk rate, we just want to point out that the risk ranges, as we've shown them on this slide, are equivalent to the risk ranges that have been identified by the United States Environmental Protection Agency. And so what the US EPA refers to as their risk management range is the estimated cancer risk between 1 × 10⁻⁶ to 1 × 10⁻⁴, and that is the yellow range that's shown on this slide. So I will use this color scheme throughout the presentation to represent these risk ranges, so it'll be consistent. Next slide, please, Dawn.
And do we have a copy of this thing, so I can go back and look at it?
We can absolutely email you a copy of this, and not a problem. Yeah.
And Suzanne, I'll actually, it's a pretty thick document, I'll warn you, but during our meeting, I'll walk you through it and point you in the right direction to where to look at your specific property and everything.
Yeah.
So it's a little easier to.
I have some very specific things. I've got chronic asthma.
No problem.
I'm going to move us along because we have people, Suzanne, and I don't want to be dismissive of your concerns at all, but I also want to honor folks that are on the phone.
We'll take care of you.
Mike will absolutely take care of you. I also want to say that not everybody's cup of tea, but I'd also like to acknowledge that we're all working very hard to be responsive to the public, and Jessica's done a fantastic job with a lot of folks. I feel like we need to say that just as a team because we all work together effectively. So please go on, Jane.
Okay. So this slide presents our approach to developing the human health risk assessment, and our process is consistent with the applicable guidance from various agencies in California, and also with our technical approach memo that Wood wrote and was approved by the Water Board. So as I mentioned on the risk assessment slide, the approach was developed to be protective of human health. So in the risk assessment, we have presented the results in several different ways. So that means that the risk assessment has a lot of numbers in it, and we understand that that may be confusing. So to help with that, I'm going to briefly summarize each of the types of calculations that we did. So first, as shown in the second bullet on this slide, we did an evaluation of current risk, and the risks for current conditions are evaluated based specifically on indoor air measurements. So this provides information about what the conditions are at the present time in the main uncertainty with that evaluation is that we don't know how indoor air measurements might change over time into the future. So things that can change over time are, for example, a change in conditions in the subsurface. So the chemicals that are present in the subsurface might move around over time, or your building might change over time, and this could have some effect on the indoor air concentrations. as I mentioned previously, we also assume that you live in your residence for a long time, which is 26 years. And so to account for that in this risk assessment, we presented a range of future possibilities that try to account for the potential for changes to occur. So we evaluated risks as they could exist in the future in 3 different ways. And this is what's shown in the last bullet. The future conditions risk is based on soil gas data from the subsurface. And the soil gas data are used to estimate possible future indoor air conditions. So the first approach is a default screening approach, and this is based on US EPA's nationwide database. This is the most stringent approach. Then the next approach is a multi-parcel wide approach, and this is based on soil gas data collected in your neighborhood and other parts of the site. So we use this approach to recommend the next steps for your neighborhood because we think it's the most appropriate and still health protective for decision making. The reasons that we think this are because this approach is based specifically on data collected in your neighborhood, and that data set is larger than the relevant data set in EPA's database. So the nationwide database created by EPA really only has data from 4 houses that have a similar slab on grade foundation construction that are like those in your neighborhood. So California agencies are actually currently compiling data from this investigation at the Ford site and other vapor intrusion investigations in California to come up with a more applicable California specific approach for this type of evaluation. So the last way we present the results for potential future risks is using a building specific evaluation. And this is based on data from your particular building instead of the whole neighborhood. So the primary assumption there is that vapor intrusion conditions won't change significantly over time for your building. All right, next slide, please. All right. All right, so this slide summarizes the risks that we calculated for your neighborhood. And we know that talking about cancer itself is scary, but when we were talking about risk, we're talking about the chance of getting cancer. So the point of this slide is to illustrate how the chance of other events occurring, like say getting struck by lightning or the rolling of a dice, compares to the risk results for the Corsica Villa area. So the colors here are the same as for the cancer risk decision boxes that were on the risk management slide. In the United States, sorry, I was right. In the United States, we have about a 1 in 3 chance of getting some form of cancer over our lifetime. So that risk would be at the top of this chart in the red, higher than the chance of rolling a 1 on a die. So for the current conditions at Corsica Villa, using the indoor air data, we were able to evaluate 2 properties and no home fell into the red for the cancer risk. And then 1 property is in the yellow range, which is shown as the dot for current risk. And then 1 property is not shown directly on this figure, but is in the green range. That was the current conditions evaluation. So the future risk range is shown with the little blue arrows there on the right. And it goes just from the lower end of the yellow range and into the green range. So since, as I described, since we can't predict the future, we evaluated those few different scenarios. And so that gives us a slightly wider risk range. So when we have results in the red or yellow, we can do something about that. And that is going to be the focus of Jessica's presentation. The goal of the next steps after the risk assessment is to move properties from the red and yellow into the green zone. So next slide, please. There we go. Okay. So this is the snapshot of the current conditions results. So we have 18 homes that are in the investigation area for Corsica Villa. And at the time we did the risk assessment, we had 5 properties where we had collected some indoor air data. And then we had 2 properties that had at least the 2 sets of seasonal indoor air data that we need to conduct the risk assessment. So we had 1 property in the yellow in the risk management range and 1 property in the green. So last slide, please. Thanks. Okay. So lastly, This is a summary of the future conditions risk evaluation. And the figure that's shown on this slide is figure 8 from the risk assessment report. And this figure also represents the recommendations that we made based on the risk assessment. So just to give you a little bit of perspective, on the figure, you can see the outlines of each property and they're labeled with a numerical ID. So we use numbers instead of addresses in these cases to maintain the privacy of the residents. And so of the properties that we evaluated, all 18 are in green. So that represents an insignificant risk level for future risk. And just a couple of things to point out relative to this evaluation. As I mentioned before, these are based on soil gas measurements and not the indoor air that you're breathing right now. So these predictions are not set in stone, and they're potential future scenarios that we developed and used to make recommendations. And again, the risks that we've calculated here being in the green zone represent risks that are considered to be insignificant and acceptable for future conditions. The Water Board is going to use these results for the future risk evaluation to make long-term decisions for how to manage the site in a health protective way. These decisions are going to be made on a building specific basis. So that is for each group of properties that are within a particular building. And since the Water Board is using the results of the risk assessment that Wood prepared to inform these decisions, they've also had OEHA independently review the risk results to provide their opinion. And that's what Amanda is going to discuss next. So I'd just like to thank you very much for your time, and I'd be happy to take any questions now or at the end.
I have a question that was in the chat, and it just says, I'm going to paraphrase this because it says, how are we notifying people in these homes? So the homes that were evaluated in the risk assessment in the green, yellow, et cetera ranges, how were people notified? And I think that's probably more a Daniela or Mike Barnes question, if I'm not mistaken. Am I right, Mike?
Yeah, sure. I'll take that one. So there's a variety of different notification mechanisms that we use. So if your home was offered indoor air sampling, meaning you fall within that 240 contour line, and what you're looking at is the shaded green buildings that represent homes that were offered indoor air sampling. If you've accepted that indoor air sampling, then there's obviously a direct line of communication that's occurring with either the tenant or the property owner, where communication access agreement sampling has occurred, results letters detailing the investigation and the results of the investigation and any follow-up that needs to occur. So that if you've had indoor air sampling, that's one form of communication, and that's the most direct form of communication that we have. If you're within the actual, just the HOA, and you don't fall into a category of having indoor air offered or indoor air sampling offered, then our lines of communication are community fact sheets. We are getting ready to send out our 8th one. So those come out about twice a year. And then if there's a particular document that is pertinent to this particular HOA, then we schedule meetings accordingly specific to that HOA. And this is the first meeting that we've had with only Corsica because of the HHRA. And then the second part of this is the SVE pilot test that we'll discuss. So those are the lines of communication that we have. And then within those lines of communication, the community fact sheets, things of that nature, there's always a link that shows you where the documentation, where all of the documentation is stored within the Water Board's website, which is called the GeoTracker. And then we also include everything within Ford's website, which is fordmbfacts.com. So everything's there, and all of those web links are listed in those mailing distributions. So those are the.
If I can just add, I think more what I was hearing with that question may have been with the results from the risk assessment. How are folks being notified where they fall? You know, is it the green, the yellow, the red? And specifically on those results, nobody's directly reaching out saying, okay, the risk assessment's complete, here's where it is, but it is informing those next steps. And that's where that additional contact is coming in. Folks who have the very obvious vapor intrusion occurring, we've seen that in some of the other communities, they were offered the air purifiers. In some areas, there's some gray area, and I'll touch on that in my presentation coming up, where we're going to do some, we've asked Ford to do some additional investigation to try and fully answer what's going on. And then that helps with those next steps.
Okay.
Thanks,
And then I
Jessica.
think we have
And
another.
I think
Oh.
Suzanne's got another, I saw her hand go up,
Please, Suzanne.
but you're on mute.
You're muted.
I don't know if maybe John, can you unmute Suzanne?
I just asked her to unmute. I don't I
Okay.
can't unmute her
Okay.
directly.
Okay.
I-
Maybe you
I-
can stop sharing.
There we
Yeah.
are,
Yep.
Suzanne. Why don't you start over?
Are there any MDs involved in any of this?
I'm not sure we're understanding the question.
Medical doctors,
Medical-
any doctors, I think is the
Oh,
question.
MDs. I thought you said empties.
So,
I think that Amanda is the
Yeah.
appropriate person to answer that.
so we don't have a medical doctor involved. It's always good to talk to your own doctor. I'm a toxicologist and I can talk to you about health effects. And I don't, maybe I can post my contact
Yeah,
info in the chat.
There's some abstract studies about the link to asthma and chronic bronchitis. So that's why I'm asking that specific question. And I do want some of this noted, so I am going to be making these comments. That's
Okay,
why I'm
comment-
taking the
comment
time to be
noted,
here
no
right
problem.
now.
Comment noted.
Thank you.
Of course. Other questions, or can we move on to?
Suzanne also asked in the chat, when was this originally found as a potential issue and when were the homeowners notified? And she'd like specific dates if possible.
When it comes to specific dates, we'll have to get back to you on that.
That's fine.
Where it all really started was with a conceptual site model, looking at all of the historical data. And so a few select soil gas probes had been installed back in 2018. At that time is when a large community fact sheet had gone out to the general various communities, including Corsica. I think that first one was, it may have been somewhere, it was mid 2018 towards the end. And then we started doing public meetings. September was the first one, September 2018, and have been notifying them. And then as far as dates for the need to conduct indoor air testing, I'll have to have Mike get to you on when they sent those out.
That
But
would
it
be
was
great.
based on the soil gas data.
Sure, that would be great. Thank you
Bet.
very much, Jessica.
Okay. Let's move on. Amanda, that's you.
Okay, sure. Okay, so as Tracy said, my name is Amanda Palumbo, and I work for the Office of Environmental Health Hazard Assessment, which we refer to as OEHA. And my organization routinely reviews risk assessments for the water boards. And I'm going to tell you a little bit about the purpose of our review and then what I found. So I think you guys can see my slides. Let me know if that's not right.
We can see them.
Okay, so the purpose of my review is to check whether the risk assessment is reliable for the project manager, who is Jessica, to use to make decisions about the site. And part of this is ensuring that the assessment is health protective. So during the review, I usually check the calculations and the resulting values, and I explain differences. I also check that the sampling data are representative of exposure conditions, and I point out uncertainties, for example, if not enough samples were taken. OEHA generally does not determine if or how the risk would be addressed. The process of my review is just about making sure the risks are described accurately. So for my review of the risk assessment for your neighborhood, in general, I found that Wood followed appropriate guidance and the calculations were correct. There were some differences, and I'll mention 3 of them. One difference is that I calculated cancer risk that was 3 times higher because OEHI uses a particular factor to protect children from chemicals that cause cancer. So Wood followed guidance from the US Environmental Protection Agency and other agencies within California's Environmental Protection Agency on this point. And this is a difference in scientific opinion between agencies, and we see this in many cases. So it's a difference that can affect outcomes, but it's not a huge difference in our risk assessment. So for the risk assessment in your neighborhood, this was not a big enough difference to affect the number of homes in the green and the yellow categories. I had the same results as Wood in that there was 1 home in the green and 1 home in the red, or sorry, 1 home in the yellow. No homes were in the red. Okay. The second difference is in the way OEHA recommends evaluating future risk more generally. The health risk might be different in the future if, for example, someone remodels their home or the foundation cracks, and as a result, more contaminants are able to move into the home, which can in turn increase the health risk. So the future scenario is challenging to evaluate because we don't know how events in the future can affect risk. So Wood included 3 different calculations to estimate future risk, which is helpful to see the different approaches. However, OEHA recommended the more protective approach, which follows US Environmental Protection Agency guidance. And so OEHA's preferred approach resulted in estimates that were 60 times higher than Wood's 2 other approaches. Again, this is for the hypothetical future risk estimates, not what was measured in your homes recently. I recommended the most protective of the 3 approaches in order to account for things that can increase risk in the future. The third difference is also for the future risk estimates. It is related to the limited number of subslab samples. So those were the samples taken under the foundation, and only 1 was taken per home. It would have been better to have multiple samples in each home, like the indoor air samples. So there were also very few homes that were sampled in this neighborhood. Because of that, I recommended the regional board, or Jessica, consider the other data, specifically the data from samples taken in roads in the neighborhoods for future risk. In other words, I'm saying to look at all the data available for the area, not just one subset of the data. This other data set resulted in higher risk estimates for future risk for some locations. So this recommendation is also typical of OEHA reviews. We often identify uncertainties we feel are significant and recommend a more protective option. So that's all I've got, and I'll turn it over to Jessica unless there's a question.
Okay, Jessica. And I think we have just about another 10 minutes or 5 minutes of our presentation and then questions and answers. So thank you for hanging in there. It's going a little longer than we had originally anticipated.
Okay, so before I get started, just want to first discuss the area that the risk assessment covers, which are the homes that are identified on the figure on the right. This is the southern area of Corsica Villas community. If your home falls in the area, indoor air investigation area, and you've been offered indoor air testing, we encourage you to get your home tested. And then lastly, the risk assessment will be updated in the future as more data is collected. Okay, so for the water board response, we evaluated the results from the risk assessment that Wood prepared and the comments and results from OEHA's review. And based on that, we considered the current risk and hazard results and the future risk and hazard results for the next steps. So first I want to talk about the current risk and hazard, which did identify vapor intrusion may be occurring at one property, and I'll discuss the current ranges on the next slide. The second conclusion is acknowledging the unknown future conditions, such as building modifications and or the degradation of the building foundation that may increase vapor intrusion in the future. As a result, future risk and hazard is calculated and considered in the next steps, which I will also discuss more in the coming slides. So now I want to discuss the results. what these ranges mean and that were calculated, and how it informs our next steps. So first, I want to talk about those current risk and hazard ranges, which is calculated from the results of the indoor air sampling. And just a reminder, when I talk about risk, I'm referring to cancer risk, and when I talk about hazard, I am referring to non-cancer health effects. Also, these calculations do assume you are in your home 24 hours a day, 350 days a year over a 26-year period. So the current risk and hazard range falls into the green to yellow area, which means homes that do not have exceedances, those are in the green area and there's no immediate response action needed. For the homes that fall into the yellow area, they're continuing to be monitored, and that information also lets us know that some longer term monitoring, additional assessment, possibly mitigation may be necessary. And that's where the future risk calculations help us in determining the next steps. So for future risk and hazard, these ranges are calculated based on soil gas concentrations. So for your community, future risk was calculated a few different ways by both OEHA and Wood. So this first way considered future risk based on soil gas results from the samples collected just below the foundation of the home. And for this community, as Amanda had just mentioned, there's a limited data set of homes that were actually sampled. And of those homes sampled, only one sample from beneath the foundation is collected per home. So this does create some uncertainty in that risk evaluation. I know earlier Jane had shown how that risk calculations for the future risk were all in the green. So Amanda, or it was like green to yellow based on Amanda's calculations. So OEHA also calculated future risk using data collected from nearby soil gas probes located at 5 and 15 feet below the ground that were in the public right-of-ways. And at the beginning of the presentation, Wood did mention that they calculated future risk scenarios in 3 different ways. So of the 3 different ways, the most protective scenario they calculated is the way that OEHA calculates risk. But it is important to compare the different calculated future risk and hazard calculations to assist in our risk management decisions. Also, I just want to mention that these future risk and hazard calculations are not guaranteed. It is an unknown right now if there will be any change from the current calculations. And that's why we do want to do some longer term monitoring and also consider these calculations in our next steps. So the ranges I'm going to discuss are from OEHA's calculations. And again, these calculations do assume you're in your home 24 hours a day, 350 days a year over a 26-year period. So first, I just want to show the future risk and hazard ranges using the most protective scenario, which had results range from green to red. The future risk and hazard using the site-specific attenuation factor ranged from green to yellow. So there was a lot of data that was collected, and they were able to determine how much the soil vapor below the ground reduces as it gets to indoor air. And using that attenuation factor, that ranged from green to yellow. So as a result, the Water Board evaluates both of these future risk calculations as well as the current risk and hazard calculations to determine the most appropriate next steps. So potential response actions in this case could be monitoring, additional assessment, or mitigation. Also, we take into consideration the higher estimation when evaluating risk and hazard calculations. An example of what we do with results like this is we want to conduct some additional monitoring of indoor air and the existing soil gas probes. But there's also some additional information from below the ground that we need in order to help us determine those final response actions. In this, I just want to point out also is a really common thing with many cases that many environmental cases that we manage in our region, and really all cases throughout this state. So
Jessica, I'm
yeah.
going to stop you right there because we do have a question.
Okay.
John, if you would read it, that would be fantastic.
Sure. The question is, they sampled my slab 3 times, however, in the same location. And I want to know why that's the case.
Yeah, so that's really common because we want to see if there's fluctuations. How does it change over time? It allows us to look at trends. Is more soil gas collecting below a foundation? Is it more breathing and kind of leaving the foundation and coming back? Things like that. But we do keep them consistent there.
Okay, thank you. Keep going, please, Jessica.
All right. From the risk assessment report, we did identify the need to collect additional information, as well as the need to prepare a feasibility study. As a result, the next steps included the submittal of 2 reports, a work plan, which was submitted on December 9th and approved, and then a feasibility study, which is due to February 25th. A revised indoor air monitoring plan was submitted back on July 21st, and we recently responded to this document, and we acknowledged the need for long-term indoor air monitoring within the response to the risk assessment and to follow that revised indoor air monitoring plan. So first, I want to discuss the additional assessment. Based on the indoor air samples and sub-slab samples, it doesn't appear that vapor intrusion is occurring, but there's nearby soil gas probes at 5 and 15 feet below the ground where these contaminants are detected, but not located close enough to the homes within your community to be certain. So as a result, prior to making any conclusions as to whether vapor intrusion is occurring or not, we want some more information. So that means we've asked Ford to collect additional soil gas in the vicinity of some homes to determine if vapor intrusion is occurring or if it's an indoor air source or a combination. And that is really common, something that we do see. There's also the need to collect additional data from within the home. And these results will assist in determining those next steps. And then I've got these, sorry, not in perfect order at the moment, but then I want to discuss the feasibility study. So this is just a comprehensive report that will include 3 main items. So first, it proposes remedial action objectives, which are the cleanup goals of the remediation efforts. So remedial action objectives need to be protective of public health, and they also need to be technically feasible to be implemented in the field. Second is the feasibility study, and this portion of the report looks at all of the remedial options and evaluates the feasibility of implementing to achieve those remedial action objectives. And the main components of the feasibility study take into consideration the ability to implement the technology, the effectiveness of the technology, as well as cost. And other factors also include acceptance by the regulatory agency, as well as acceptance by the public. And the third component for this report will be to develop potential remedial alternatives, and based on the feasibility study and remedial action objectives, recommend one. And then there's the indoor air monitoring plan. So this is a longer term plan to evaluate indoor air to verify if vapor intrusion changes over time. And this is where we can take into consideration those parcel wide attenuation factors that would develop. There's been a lot of data collected, not just at this community, but for the project as a whole. And this is an appropriate way to utilize it. So this longer term monitoring plan will provide analytical data to support whether the current risk and hazard calculations are still appropriate or not. The monitoring frequency will be based on soil gas concentrations and trends, and the frequency of sampling can range from every 6 months to once every 5 years. And Ford will be sending out letters at a later date to notify you of which sampling frequency category you fall into. So now I'm going to shift to the soil vapor extraction pilot test. But before I start, was there any other questions regarding the risk assessment? All right.
I believe Suzanne had a clarifying question about her property, if I'm not mistaken.
Well,
Yes, Suzanne?
I'm just, you know, I'm involved. I work in the industrial food sector. That's my business. And just understanding food safety and some of those issues. You know, I'm not a scientist or a toxicologist, but there seems a lot of, like, there's a lot of holes in the methodology. Again, I'm not a scientist, but it just based on my own personal situation, where I guess I can talk to Mike about that further.
Yeah, Suzanne, happy to walk you through all of that. And I think we can paint a
And
much
then-
clearer picture. I just
then
sent you an email for an
Yeah,
invitation
and
for
then
a call
lastly,
tomorrow.
you know, I do know that Ford is probably paying, you know, for the individuals participating in this study, and that, you know, it is what it is, as they say.
Oh, I just want to clarify, I'm not sure what that means. The individuals participating in this study, this is an investigation.
You and Jessica and Wood and
Ford.
No. Yeah,
So
Jessica, why don't you
yes.
chime in on that one?
Let me provide a little clarification. So
yeah.
I work for the California Water Board for the Santa Ana region.
Okay.
We're under the blanket of California EPA. So we're the regulatory agency. And when there's a contaminated site, we identify the responsible party. In this case, it's Ford.
Okay. Yep.
And we have one of two ways to move forward with getting a site assessed and cleaned up. One, what is our preferred approach is that the responsible party, whether that's the property owner or preferably the discharger, and again, that would be Ford, that they enter into a voluntary cleanup program with us. That is what Ford is doing. The other way would be that we use our authority under the water code to make them investigate and make them clean up. Thankfully, Ford is doing this voluntarily, so it does make things run smoother. But Ford pays for our oversight time, but does not directly pay. That's within the water code that they are required to do that. But we are very objective in our reviews, and their reimbursement of cost oversight does not affect that. And even if they weren't voluntarily a part of that program, folks who are under investigative orders or cleanup orders are also required to pay for our oversight.
I'm going to just do a quick time check. We're at 6:21. We have a question from somebody else, and I'd like somebody else to have an opportunity to ask questions too. Suzanne, Mike sent you an invite for a meeting, and I think you can follow up on those issues. I want to be cognizant that you wanted to get some comments on the record. You can always send a letter to the water board, and that is a public record as well, Suzanne. So just wanted to make sure you knew that too. And the other question we have is the reason those particular properties are being tested because that area has the highest concentrations?
So they're being tested because they fall within, it's based on the concentrations of soil gas from below the ground. And we have certain screening levels that we have been utilizing that triggers the need to go to indoor air.
Okay. All right.
And if I can just chime in on that. So earlier you saw a figure that showed an ISO concentration contour line of 240, and that is the edge of where we offer testing. So it is at the very low end of our range. So to give you some additional perspective, the perceived concentrations below the homes within this particular HOA probably range from 240 or non-detect to probably 300, 400, 500 maybe parts per billion per cubic meter, or micrograms per cubic meter. In some of the areas where we have higher concentrations, those concentrations are 50,000 micrograms per cubic meter, which is still relatively a low number when considering soil gas concentrations. So this is on the edge of what we consider the area of concern.
What I thought. And then if you live in Corsica Village and not Villas and not in the area that's being tested, then you're probably even lower than these condos that
Correct. And that
Absolutely.
screening level is a conservative screening level to determine whether or not indoor air sampling is going to be offered to determine if there is actual vapor intrusion occurring. Just because you have the vapors beneath your house doesn't mean that vapor intrusion is occurring. So it's kind of the low end of the cutoff where we say, okay, if you're outside of this area, it's been determined that that's not a risk for vapor intrusion.
Okay,
And then Mike, you're using conservative in terms of protective, correct?
Very protective of human
Very
health.
protective.
And,
Okay.
and I will also just add that what we're seeing over the 3 years of sampling, what we are seeing is we're seeing attenuation in soil, meaning as the concentrations where we tend to see it a little higher concentrations versus less would be deeper below the ground. So the 15-foot probes tend to have the higher 5-foot. And then when we are able to sample the subslab, so just beneath the foundation, we're tending to see incredibly low concentrations, but typically non-detect. So those are really good signs as well.
okay, thank you very much.
Okay. Jessica, I am going to ask you to finish up your presentation so we can get people
Yes.
out of here on time.
Absolutely. So I'm going to hopefully just blast through this one. This
Okay.
is about the soil vapor extraction pilot test that was recently conducted. The pilot tests were conducted at 3 locations: the Bonita Creek area, which is that CalTrans right-of-way adjacent to the Newport North apartments on the east side, Bay Ridge Park community, and the Sea Island community. And we are going to discuss the one that occurred at the Bonita Creek area, since that's located closest to Corsica Villas. And that data from the pilot test is what's going to be used in the feasibility study when evaluating that particular remedial technology. So before I talk about the results, just want to provide a quick refresher about soil vapor extraction, which is also referred to as SVE. So this figure is just an example of how this type of remediation works. Soil vapor extraction is a remedial technology that can remove vapors from soil above groundwater. So that's what would be used as an active remedial technology for extracting soil vapors. Contamination within that vadose is removed in the form of vapors through extraction wells, and the vapors are treated above ground, and then clean vapors are released to the atmosphere. So another refresher would be this inlay that just shows those soil particles and how vapors can reside in between the spaces of the soil. So pilot tests were conducted at 3 locations, and the nearest one being that Bonita Creek, due to the close proximity and similar conditions below the ground. That's the one I'm going to talk about. So the pilot test consists of 1 extraction well. The pilot test ran for 5 days, and during that time, nearby soil gas probes were monitored to evaluate 2 main things. First, vacuum pressure to see if and how much effect the extraction well is having. Then second, soil vapor data is collected from the extraction well and those nearby soil gas probes before and after the pilot test. Data is collected during the pilot test and was used to evaluate the radius of influence that is shown by this green elliptical. And that allows us to just know how far is that vacuum from the extraction well reaching, both laterally and vertically. And then also how much contamination is being removed. So for the radius of influence, again, that's how far the vacuum effect of the extraction well reaches. Industry standard radius of influence of a typical site that would consider this technology satisfactory would be 20 to 50 feet. For the Bonita Creek area, the radius of influence was 89 feet, and that result indicates a good ROI for the area. The total mass removed, which is how much contamination was removed from below the ground, industry standards of a typical site suggest that mass removal of 1 pound per day or greater at the start of soil vapor extraction is satisfactory. So during the pilot test, a total of 0.02 pounds was removed in the 5 days, which was over 46 hours of operation. It only operated for about 8 to 10 hours a day. So that's where the 46 hours comes in. And this is really consistent with the low VOC concentrations that have been detected in the subsurface in these areas. So the results of the pilot test will be used in the feasibility study when evaluating the best remedial approach for the site. So as I mentioned a few slides ago, the feasibility study takes into consideration the ability to implement the technology, the effectiveness of the technology, and cost, as well as acceptance by the regulatory agency and acceptance by the public. So for those of you that were at the Water Board public meeting in November 2019, you may remember my analogy on the effectiveness of soil vapor extraction based on soil type. And I compared it to a milkshake versus a slushy. So the milkshake represents that tighter, fine-grained soil like clay, which makes air movement more difficult and limited. And the slushy represents a soil type that's more permeable, where air flows easier like sand. So the radius of influence results indicate a slushy. So the type of soil below the ground, favorable based on that particular metric. But the mass removal results indicates that almost finished slushy. You suck on the straw, but you don't get much from it. So in that regard, soil vapor extraction may not be as favorable. And these considerations are important in the feasibility study when determining the best remedial approach for this site. So to summarize, the risk assessment results support the risk management decisions. The work plan was submitted to the Water Board on December 9th, and it was approved. The feasibility study is due to the Water Board no later than February 25th. The soil vapor extraction pilot test results are used in the remedy evaluation. The Water Board response is pending for the feasibility study, and we are going to host a meeting to discuss the feasibility study as well. And I see that it's 6:30. So this is just a list of where you can get additional information. And I know John put the link for GeoTracker as well as Ford site specific website and contact numbers in chat. And then there's the local information repository at the library.
Great, thank you, Jessica. So I want to say that we have a couple people that have remained on, and we're happy to stay 5 or 10 extra minutes for questions. Suzanne, I think we're following up with you individually. I also want to respect people's evenings. So with everybody's concurrence, particularly to Suzanne and Kathy, we're happy to stay 5 or 10 minutes after to answer questions. Would you like us to do that?
I'm fine. Thank you very much. This is Kathy.
So no more questions, Kathy?
No, thank you.
Okay. Suzanne, what about you? Can we follow up with you individually tomorrow then?
You know, the only question I had maybe for Jessica was how does weather, you know, affect and this last group of results that you spoke about, you know, I guess I'll have to read over the information and all the slides, you know, to probably ask more informed questions. But, you know, I would think weather would really affect some of these vapor intrusion issues.
It does, and that's why we have that's why samples for indoor air are collected over the 24-hour period. That's why we collect them a couple times. We don't just rely on one sampling event.
Right.
And a lot of times we are looking for more information, because sometimes with vapor intrusion, it is really clear cut. Yes, that is vapor intrusion occurring. And then there's other times where there's gray area, and it's from the data that's collected below the ground and then the data that's collected in the air. Sometimes there's more questions. And when that happens, a lot of times that's when we go for looking for additional lines of evidence. And that's really common. And one of the things that we're asking Ford to do with installing some additional soil gas probes, the next time they sample homes, they may be asking additional questions or sampling additional things just from inside the home. We've done that to a number of homes in other communities where there wasn't a clear-cut answer as to what we were seeing inside the home from those indoor air concentrations.
Well, and what about like a hillside?
Mm-hmm.
Where,
yes.
You know, your unit is right up against a hillside.
And we have that in one of the communities. And so there happens to be crawl space, and it's on the side. And so we're using a combination of collecting data from below the crawl space, they collect the sub-slab data. And then in the risk assessment, we're also looking at those soil gas concentrations in the right of way within the street that are a little further away from the house to really have supporting lines of evidence to assist with the risk management decisions that we make and that we are asking Ford to conduct.
Okay.
Okay. And I would just add that I think with science, data is king, right? So the more data that we can collect, the more confident we are with our decisions. And that's why we come back 1, 2, 3, 4 times, because we really want a robust data set to make informed decisions. And I think with that comment, I am going to say thank you, Suzanne, so much for your questions and joining us tonight. And Mike will be following up with you to have an individual meeting.
Yeah, Suzanne, can I confirm your email address? I just sent you an email to, did you receive
Please
it?
don't confirm it. Please
Yep.
don't confirm it over
Yep.
the public meeting because we're recording.
Just want to make sure you received it.
Yes, I have it. Thank you, Mike.
Perfect.
Okay, excellent. Thank you.
I'll let you two follow up, and I want to thank everybody for joining us tonight. All the best for your evening.
Thank you.
Thanks,
Bye.
everyone.
You too.
Thank you, Suzanne. Good night.